Hello everyone, I am Dr. Dilip Kumar, Director of Cath Lab and Structural Heart Expert at Medica Hospital, Kolkata. We have witnessed percutaneous coronary interventions saving millions of lives over the last 4 to 5 decades. And so fulfilling to see the same thing getting reproduced in the field of percutaneous valvular interventions. And these are called transcatheter valve replacements or repair. What we mean with transcatheter valve replacement or repair is don't put the knife on the patient's chest. We go through the groin, we do a small pinhole puncture, and then we either replace the valve. Replace the valve means we get into the valve, dilate the valve, and put a newer valve inside the diseased valve, which starts working instantly. What we mean with transcatheter valve repair, it means we get into the valve, we put a clip or we put a band around it, and it starts working in a different manner. It reduces the leak. Of all these percutaneous valvular interventions, we have seen the biggest success in transcatheter aortic valve replacement, what we call TAVR or TAVI, and it has really saved lakhs of very sick aortic stenosis patients who were either surgically turned down or were having severe or moderate surgical risk for operation. Although we have seen success, but we have been encountering some problem for the last 5 to 6 years, maybe 1 decade with these transcatheter valves. Something about some complications in form of pacemaker requirement, in form of paravalvular leaks, where we require a new valve to be given, or sometimes emergency surgery. We have to take these patients for emergency surgery because the leak is very high because the valve has not been put properly, or the sealing skirts are not proper. We also see some complications like stroke, coronary occlusion, and one of the biggest problem was coronary reaccess. Reaccessing the coronaries were a bigger concern in these patients. But I am so happy to say that now we have got some valves which has reduced these complications to a bare minimum. So valve which can be easily deployed. Gone are those days where we have to just go on releasing the valve. It's just release. After initial deployment, very quickly you can release. The coronary access is so easy because it has got a large frame cells, and chances of PVL is almost negligible, very less. It has a very good sealing skirt which reduces the chance of PVLs. And nothing to say about the requirement of permanent pacemakers. We have seen this kind of new valve gives a very less chance of pacemaker implantation and need of pacemaker implantation. Amongst our experience with TAVI at our hospital, we have been able to give so many patients a new lease of life. We can't guarantee success in all the patients, but what we see in future with these new kind of valves, the complications rate will be further go down, and we are reaching to a place where in true sense we are going to give patients a safe TAVI procedure. The treatment procedure has matured, the valves have matured, so as we operators have matured. Now I think this is a golden period for all these aortic stenosis patients to avail this opportunity. I wish good luck and health to all these patients, and we pledge to give our best to sick aortic stenosis patients best possible outcome. Thank you so much.